make a big impact in the communities. And that's how the Global Grace Health partnered with Grace Cancer Foundation in India. And we're able to today serve communities, not just in India, but across the world, and cater to the needs of healthcare needs of underserved communities. So I'm thankful to each and everyone who have joined here today. And those who could not join also, I'm grateful to you for your support in many ways, not just monetary, but your time was much more crucial, and also the way you have helped us to come together even during the internship program that we have done and the ball that has been done last year. I think we'll go through all of them during our time of reflecting into the impact that has been created in the last 1 year. But one thing that is surface here is that tough times bring people together with passion, and when passion and purpose come together, greater impact can be created. So that's what we are here to celebrate, what Global Grace Health has done in the last 4 years, more so in the last year. And together we celebrate this. And I'm so excited and thrilled to see each one of you and look forward to these celebrations. Thank you.
Thank you, Dr. Chinababu Sunkoli. It's really a great coordination between GGH and GCF for the last 4+ years. And we continue to collaborate and continue to provide excellence in healthcare and also internships and other programs in India. Thank you very much one more time. As we continue, let's play our US national anthem followed by Indian national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 जय
Jai Hind. I welcome now Verma to give the curtain raiser about GGH.
As we enter this world, we encounter a range of challenges. We are confronted by the stark reality of non-communicable diseases. Conditions like heart disease, diabetes, and cancer are not just statistics, they are the stories of our friends, families, and communities. At Global Grace Health, established in 2021, we answered that call with a bold vision to redefine healthcare on a global scale.
Global Grace Health is committed to promoting wellness and healthcare and help build healthy communities around the world.
Together, we can transform challenges into opportunities. The future of global health starts here. The future starts with us. Collaborations. In just 4 years,
possible because of the collective effort, and I request each one of you to continue to join hands with us. Together we can collaborate and touch more lives, and we all are living for a legacy. Thank you so much.
together, we made a tangible impact on the lives of over 15,000 screening in this year and 28,000 in last 4 years. Our mobile cancer screening buses traversed the length and breadth of Odisha, Telangana and Andhra Pradesh, reaching even the most remote areas.
I'm truly grateful to all of you for your contribution to this incredible moment supporting Global Grace Health on its mission to make a positive impact on the lives of those in need.
This year we successfully conducted health screenings for 18,000 individuals across 80 villages. Through these efforts, we identified 1,100 abnormal cases. We organized 67 health camps in Araku, screening 4,527 individuals, empowering communities with healthcare knowledge and resources. This year marks a significant milestone in our mission to prevent cervical cancer as we elevate our efforts by integrating HPV screening into our program. The Grace Cancer Foundation proudly launched an impactful internship program in association with GGH for students during the months of June, July, and August. Building on the success of this initiative, we are excited to announce the addition of another group, expanding opportunities for even more students to participate.
So your dedication and passion have reflected quite clearly through and touched countless lives for bringing hope and healing to those who need it most.
The Quambient Global Grace Cancer Run 2024 saw an overwhelming response, with 20,000 participants in Hyderabad, India alone, and a staggering 100,000 participants globally. This was a proud moment as thousands came together to raise their voices for cancer awareness and early detection. Join hands with Global Grace Health and be part of the mission to reach the unreached.
Thank you, Verma, for the curtain raiser. It's really great how we are moving forward, helping other communities across the globe. Now I request Dr. Joseph Potugurigaru and Dr. Daniel Rajaya to introduce our chief guest.
Thank you, Honorable Ambassador Binay Pradhan, for giving your precious time to join us and to inaugurate and bring greetings on the occasion of the 4th anniversary of Global Grace Health. May I request Daniel Rajaya, my young friend and a colleague who worked closely with Consulate's office in New York, to introduce the Ambassador Pradhan. And Daniel himself serves as the Global Director for MasterCard. Daniel Rajaya, would you mind please introducing our chief guest?
Sure. Thank you, Dr. Paturi, and thank you all here on the call for all your work with Global Grace Health, and congratulations to the organization on celebrating 4 impressive years of doing incredible work in healthcare, not just in India, but across the world. So at this time, let me introduce you to our chief guest, Ambassador Binaya Pradhan. Ambassador Pradhan, he is a career diplomat of the Indian Foreign Service. He speaks English, Russian, Hindi, and Odia languages. His diplomatic career includes senior roles in Indian embassies in Moscow, Turkmenistan, and Pakistan from 2004 to 2012. From 2012 to 2014, he managed India's relations with Afghanistan and Iran at the Ministry of External Affairs in New Delhi. And then from 2014 to 2019, Ambassador Pradhan served as the Chief of Staff to the Minister of Petroleum and Natural Gas for the Government of India. His international engagements extend to being the Deputy Chief of Mission in the Indian Embassy in Moscow from June 2019 to July 2021. And prior to his current role that he's doing now as Consul General of India in New York, he held the position of High Commissioner of India to Tanzania and permanent representative to the East African Community. Ambassador Pradhan is married to Miss Mona Lisa, and they have 2 proud daughters. And we are very, very privileged and honored to have you, sir, join us on this call. And as Dr. Paturi said, to celebrate some of the good work that Global Grace Health has been able to do, specifically in India. And so at this time, I'm going to turn it over to you, sir.
Thank you. Thank you, Mr. Daniel. It's an absolute pleasure, absolute honor to be a part of this distinguished gathering. So Dr. Joseph Paturi, President of the Global Grace Health, Dr. Alok Agrawal, Mr. Daniel Rajaya, other members of the Global Grace Health and Grace Cancer Foundation. A very good morning and namaskar from New York. Like I said, this is a real honor to be part of such a distinguished gathering, and I spent some time to go through the website of both Global Grace Health and the Grace Cancer Foundation, and I must say it has been quite impactful journey that you have made. Global Grace Health in last 4 years, and even the Grace Cancer Foundation, I saw their work in Sierra Leone to other parts of the world and in India. That of course includes my home state, Odisha. Truly impactful work and very impressive journey that you have made in a very short time. And I'm sure the credit goes to all the members who are dedicated in a dedicated way working for this cause. In your website, I also saw the objective, and I particularly liked a particular sentence that you have mentioned. Your objective being to provide care and compassion with commitment in reaching the unreached. So that's something, very powerful statement. And like I said, I saw your work in the website about what you are doing. So truly my compliments to you all. I have spent about a year now in United States. I am familiar about the great work that Indian doctors, Indian caregivers, Indian nurses are doing in this country. Recently, we launched a report of Boston Consultancy Group that was on the impact of Indian diaspora is making in United States. And there I came across the statistics about Indian doctors. So while we are 10% of the total American doctors, but we are treating about 30% of the patients here in this country. And similar is the story about Indian medicine in generic and other segments. And I think equally impactful is the story of Indian nurses, Indian caregivers. I would say this set of people, Indian doctors, they are the true soft power that India has in this country. They are reaching a lot of people in the mainstream United States, and they are bringing India close to their heart and creating a lot of goodwill for India in the mainstream United States. Coming to India, there also the landscape is changing. You all are working in India in both direct and indirect ways. But I'm sure you are also familiar with the positive developments in India, for example, the Ayushman Bharat, which is providing health insurance now to about 500 million people. John, also the Kendras, which are providing very affordable medicine to people. And in fact, last week I did my annual health checkup, and I found that 250 rupees medicine from India is costing $500 here. The same ointment, So I was rather, kind of not so happy to see that Indian medicine, which are so affordable in India at $3, are costing $500 here. But I think the things in India are kind of looking positive. The change in the mindset of our society, our people, is also quite commendable. You see the sense of hygiene. Recently, we concluded Kumbh Mela with participation of about 55 crore people, 550 million people. And recently, we did a program here where the focus of the speakers from Harvard Business School was on the Swachh Kumbh that was organized in India. So I would say, the society's mindset is also changing towards, better hygiene, better healthcare in the country. And now, if you ask me as to what is it I would expect from such a distinguished gathering like yours, I would say two things. Like I mentioned about the Indian diaspora, I, as Indian Consul General here, I deal with 2.4 million strong Indian diaspora in the 10 states of the Northeast. And during my interaction with Indian diaspora, during even the report that we came out with from the BCG, we came across the statistics, which is quite worrisome. That's about 6% of Indian diaspora in the United States are belonging to below poverty line category. So it's not that entire Indian diaspora in this country is in the prosperous category. So there are 6% people which are largely women. They require our attention, and good hearted people like you, I'm sure, should also keep them in your priority list. And the second is about India. You all are doing commendable work in India. But if you ask me what India needs from such a distinguished, diaspora that we have in this country, in one word, I would say technology. I came across very, very distinguished people in my last 1 year here. I was in MIT, met a professor, Pramod Sinha. He is providing neurological solution to children who are born blind in India. But now, thanks to neurological interventions, they can have eyesights now. And in last 2-3 years, they have given eyesight to more than 600 such children who were born blind, but now they can see the world. So that's the role of technology, which can bring such life-changing experiences to Indian kids. What you are doing in terms of cancer screening is equally impactful. What we need is such technological interventions into far-flung places where while the government intervention has been there, but I think the best of the technology from United States through people like you can make a big change. I would conclude by again expressing my compliments, my congratulations, that in last 4 years you really have had an impactful and impressive journey. We as a consulate, if we can be of any assistance, any support, we'll be more than happy to do that. Like I said, we really feel grateful that we have such a distinguished community and such a distinguished set of people who are working around the world with focus on India. So my sincere thanks to Dr. Joseph Paturi and the entire team of Global Grace Health again for organizing this event, and also inviting me to such a great gathering. Thank you so much.
Thank you, sir.
Thank you, Dr. Thank you, Ambassador Pradhan. It's really an inspiring speech, and thank you for encouraging us and giving some statistics, and also especially about Ayushman Bharat back in India, which is serving more than 5 million people. And I'm super surprised to know that a 250 rupees medicine is costing in $500 in US. But thanks to our Indian pharmacy companies, those who are producing this kind of products for 250 rupees. And it is even more surprising for me to understand that there are 6% of people, Indians in US, under BPL, the below poverty line, and especially women. Thank you for bringing this to our notice, and it is a learning for me especially. And from GGS, we will do our best to support these women in healthcare, or giving any kind of support to help them to get to be a better community and better health. Thank you very much. And also, I appreciate for giving us some enlightenment about this neurological technical insights, where that's technology is giving sight to kids who were born blind. That's really a great achievement. GGH and GCF is also coordinating with other technology companies like Google and other. In future, definitely we will evolve more technically and provide great support and great help to our community back in India and in other places. And also, as you mentioned, even in US to support this BPL community. Thank you very much again, Ambassador Pradhan. It's a privilege to have you, and it's a great note for us and an encouragement. With that, I will request Verma to give insights about Global Grace Health.
Thank you, Suresh. As Dr. Chinnababu and Dr. Joseph Paturi have alluded earlier, we start with a mission to provide education, scientific research, modern technology, innovative methodology to in the healthcare realm, with a vision to provide new approaches and initiatives to move forward the healthcare industry around the globe, not just here in US, not just here in India. India, whatever we are doing, along with GCF, is a boilerplate model that is being developed and which we wanted to take it to other places also across the world. Our objectives, like a couple of them that we've listed here: preventive health awareness, enhance patient care, streamline clinical management, and also personalized lifestyle coaching and rehabilitation. So with that, GGH founding members and board are here: Dr. Joseph Paturi, President of Global Grace Health; Dr. Kiran Avancha, he's Vice President and Joint Treasurer; and Dr. Chinnababu Sunkwali, who is a member at large and also our partner with Grace Cancer Foundation, Kiran Avancha and Dr. Chinnababu Sunkwali. Ms. Chandu Tota is also a member at large and one of the founding members for us. Ms. Suresh Bandugla, he's the Director of Institutional Advancement. I'm humbly serving as an Executive Director and Secretary. Then each of the different areas, regional areas, we have directors that are supporting us. With them and their friends, families, and supporters across, we are able to do what we are doing. Mr. Srinivas Amerisetti and Mr. Murali Pasumarthi from Massachusetts, and Mr. Vidya Garapati from New Jersey, and John Sulpolli from New York, and Srinivas from Pennsylvania, and Dr. Joseph Paturi himself from Ohio, and Mr. Adam Kolipara from Michigan. And from the South Atlantic region, we have Mr. Das Chebatini, take care of the DMV area, Mr. Deva Veeraswamy from Texas, John Spurgeon from Tennessee area, and Emmanuel Rampa is working with us in North Carolina. Can someone mute, please? Yeah. Yeah. Mr. Subbu Manakonda from Texas. US regional directors from the West, Dr. Kiran Navancha from Arizona, Babu Peter from Utah, Sunil Mogadati from Colorado, and also Clement Lavu, and Ms. Chandu Tota take care of our operations in California and providing us a greater support. Similarly, internationally, from Africa, Dr. Ajiboyi and his team across Africa, several countries, that they've been supporting the Global Grace Cancer Run every year, and they've been with us all through these years. And from Oceania, we have Mr. Enoch Moses from Australia, Dr. Ravi Musku as well. And from Europe, Ms. Sonia Chadanihau and Mr. Peter Samuel, and Central and South America, Paulina Risco supports us. Internationally, from the Grace Cancer Foundation, Mr. B.L. Sujata Rao Garu, and Dr. Chinnababu Sunkwali, Dr. Pramila Rani, and Dr. Hemant Udayaraju, and Dr. Kiran Avancha themselves from the board, and a lot of support from GCF in every step of the way, whatever Global Grace Health is here today, because of the initial efforts from Grace Cancer Foundation. And in terms of the impact, So throughout these years, 1.5 million lives have reached. When you see that big number, you might think, what is that? What happened? Like we started in 2021 to spread the wings of GCF. We started with Global Grace Health in USA, but the pandemic hit at the same time. And when the masks and other the oxygen cylinders and everything are scarce, we supported sending million plus masks from here, and then we have supported with oxygen concentrators to different hospitals also from here. And there are around 700 plus volunteers working across, and 250 plus events were conducted, majority from the Global Grace Cancer Run and awareness sessions as well. From our efforts here, there are about 120 plus villages covered in India. And for the Grace Cancer Run, as I mentioned, 130 plus countries, people participate from across the world as well. So far with our efforts, even though Grace Cancer Foundation is doing much in a larger scale, with little efforts that we have put in, about 1,100 cancers were detected. So we have with the GCF 6 state-of-the-art cancer screening buses, 28,000 screenings in the last 4 years in Telangana, Andhra Pradesh, and Odisha areas. Especially a special mention from cancer screening campaign that started in Odisha, which has expanded our wings into Odisha as well. Our beloved president from India was there at the place when we have a screening campaign in Odisha as well, in and around the places where she hails from. These cancer screening camps are conducted. The Odisha camp overview, there are about 2,957 individuals screened and found about 776 abnormalities. Cuts across 12 villages in Odisha with advanced diagnostic testing, and all our buses serving the population there. You can see a lot of different numbers from here, from the patients that are with anemia and other aspects as well that you can see. In the Araku area in Andhra Pradesh, there were about 4,527 participants, and 1,304 mammograms were done. And diagnosis with that, about 141 diagnoses were done, and similar numbers like nearly 1,500 pap smears were done as well. As part of the regular work that we do, these are the tests that happen and the screening campaigns. In terms of educational programs, with the help of Grace Cancer Foundation, we provide awareness drives, online webinars, offline meetings, and Grace Cancer Run as well. Every year around October, or depending on the locality, the time that works for them, we have a Global Grace Cancer Run, where a lot of individuals and volunteers come together, conduct a kind of awareness drives in their respective areas. And 150,000 students, we want them to become ambassadors. And November 7th being National Cancer Awareness Day, and there are a lot of activities that happen around that time as well in India. And with a lot of efforts from the ground, Dr. Chinnababu Sunkwali keeps going to different areas for providing awareness series as well, awareness sessions. And South India, within South India, from Jawaharlal Nehru Navodaya Vidyalaya, there are about 100,000 students across South India participate in the run as well. As Dr. Chinnababu mentioned earlier, last year, for the first time, we have started an internship program from children in USA to have a first-hand experience on the ground back in India, It is a curriculum for them to learn, but at the same time on the ground, work with people, be part of the mentoring program with a lot of doctors and healthcare professionals back in India. They also participate in research, but also keep working on the ground as well. And for this year too, we have in July for a couple of weeks, we are planning to have a few members or a few students from USA join there. But this program, coming years from 2026 onwards, we would like to open it up for others too. Please do let us know if you have a kid anywhere like 10th grade, 10th to 12th grades kind of. So it will be a great experience for them to learn, and also on the ground they can serve people as well. And as I mentioned, Global Grace Cancer Run that works across several countries. Within North Central America, about 10 countries. Within US also, there are a number of places where we provide or we conduct a Grace Cancer Run. Had increased to South America, about 13 countries. Africa, Dr. Ajiboy self, we reached about 42 countries. Within Europe, people, patrons of Grace Cancer Foundation, Global Grace Health, that are in 25 countries, and within Asia, about 36 countries, and in Oceania region, about 4 countries that we have reached out. And some glimpses from Hyderabad, India, but also across other places that I'll share. Those pictures are not one-to-one for the location, but we have conducted Grace Cancer Run this year in Dallas, Houston, Halifax, New York, Boston, back in India, Noida, Washington, New Jersey, Baltimore, Detroit, Nashville, in India, Bangalore, and in India, Janalgada and Pune as well. There's several others that with the due respect to time and everyone, we haven't able to put every picture out there, and we couldn't cover every location. But there are about people from 130 countries that participated. And a special mention about Global Grace Health Charity Ball in Virginia. Mr. Srinivas Atli and his team has done tremendous work there, reaching out to friends and families and well-wishers there, and conducted a kind of cancer awareness, as well as an event to fundraise too, which was a very successful event this year. And we are planning to expand it to other areas as well. And GGH journey this year and way forward, as mentioned, 20 total of so far all the screenings that have happened, 25,000 to be precise, 28,000 plus. And then we have an app for detecting cancer without much. It's a data for research and paperless screening as well. And we are making some progresses in these areas too. The prevention, we have awareness drive in 130 countries as mentioned, and reaching 1+ million people. And it's a lifestyle coaching and HPV vaccine. That is another area that we are planning to increase our presence. HPV vaccine being a very effective method for avoiding any future cases as well. And that is going to be our drive going forward as well, screening for women. And also we are planning to tie up with a local non-profitable organization here in USA that is planning to support for eye screening camps in India as well. That will be way forward in 2026 or 25. And with great support from a lot of well-wishers, friends and families, and the organization that support us, we have done what we have done so far. How can you be part of a Global Grace Health mission? If you are affiliated to, or you have a close affinity to a place in India, in these areas for now, Odisha, Andhra Pradesh and Telangana, but we will in future expand it to other areas as well. Feel free to let us know, and we can set up and have a cancer screening camp in your area. You can sponsor that. and you can be a volunteer and create a greater impact to the humanity. Sometimes a lot of corporates in USA provide corporate matching programs, and take advantage of that. If you're supporting or sponsoring, work with your corporate and say what kind of matching programs are they providing. And we have registered with at least 5 different platforms that provide, and around 10 plus companies through those platforms provide the matching grants to us. We wanted to expand our cancer awareness runs to different areas. You can take a small local park or your community. Do let us know. We provide all the support and the material needed as well to have a cancer awareness run in your area. You become an advocate and adopt a college for HPV vaccination. Primarily in India, this is happening. You can adopt a college and we can work with you closely to provide the HPV vaccination to those areas. Ways to donate, we have several ways online through PayPal, Zelle, GoFundMe, and we have checks as well, banks, either EFT or wire. Corporate matching programs, as I mentioned, Benevity, Donation Exchange, CFC giving for federal employees, and Bright Funds. Recently, we have added a Blackboard as well, is another platform that we are working with. So with that, I will close. Suresh, back to you.
Thank you, Varma. It's a great insights about our GGH and GCF together, how we are moving forward in a lot of achievements. There is much more to do in future, and we expect or anticipate from our well-wishers, coordinators, and collaborators to continue to support GCF in various ways. I would like to remind one more time who are in US, GGH is a 501(c)(3) company. So all your donations are, you will get a tax benefit from it. Thank you one more time, Varma. Now I'll take it, I request Mr. Das Chebatina to give the reflections.
Hello, I'm Das Chebatina. I'm the Regional Director of GGH for the Greater Washington, D.C. area. Congratulations, and it's a great time for me also to see you everyone here today at our 4th anniversary event. Well, it's been an incredible journey reaching 1.5 million lives in just 4 years. I'm sure you all agree with me that there is still so much more to be done, and the need for our help is greater than ever. And it is only possible through the incredible support from partners like you and all around us. As you all may know about this Global Grace Health and the effort towards the cancer awareness runs that we organize, definitely that is the biggest event that we organize here and globally. So this year in the US itself, we have organized around 15 cities, which is 5 more than last year. That is a big achievement from the leadership perspective. And we've seen 3,500 people participating in that Global Grace Cancer Runs. A big thank you to all the partner organizations who have supported these runs, and especially the regional directors for their leadership. They spent a lot of time and their leadership and talents there, and their connections and network, and also the volunteers who spent a lot of time and their dedication for these events. As Varma Garu mentioned also, special thanks to Atili Foundation, Srini and Manju Atili Garu for their tremendous support to GGH. This is the first time that we are actually able to do this kind of event, like gala event in Virginia, which is very, very successful for us, first event that we were able to organize here. And that opened a lot of doors for us to be able to connect with a lot of people here in this area, and a lot of organizations across US who came forward to support Global Grace Health. I'm sure that we'll be able to organize this kind of events and strengthen our support base for Global Grace Health. Now, let's listen to the reflections from some of our partners. Especially want to hear how they are inspired with the work that GGH is doing, and they started supporting GGH.
As we celebrate the Grace Health Cancer Intervention, another year of excellence, I bring greetings from Africa, where I live, and I am grateful for what has been done. On behalf of every family in this large, massive continent, on behalf of those that have been touched by cancer, including my own family, in the last week that we lost someone precious to us. Thank you for bringing awareness. Thank you for being an agent of life. We stand with you, Dr. Patori, Dr. Chinababo, and the whole team. Thank you for bringing great leadership to our world. Thank you.
Good morning and good evening, Global Grace Health members, family, friends, and supporters. My name is Adam Kolapara, and I've been a GGH North Central Regional Director for the past 3 years, located in the Northville area, which is a suburb of Detroit, Michigan, USA. I would like to extend my personal welcome to you all at this 4th anniversary celebration of GGH. Since joining the organization, I've hosted 3 Detroit area Global Grace Cancer runs, and as the assistant band director and percussion instructor for the Northville High School Band, many of my students participate in the runs from year to year. This past year, through participation and donation, these students, their family members, and many friends have helped us raise the most funds we have since the Detroit area run began 3 years ago. I'm hoping for an even greater turnout this year so that we can continue raising awareness for the cause among our near and dear ones and the general public. Thank you to all of you for your continued support and contributions to Global Grace Health, and I hope that this 4th anniversary celebration is a blessing to all.
Hello everyone, I'm Srini Atuli, and I've recently come to deeply respect Dr. Chinababo Garu and the incredible work of Global Grace Health. I'm thrilled to congratulate GGH on the 4th anniversary. Your commitment to reaching the unreached, delivering essential health care where it's needed most, is truly inspiring. Through education, research, and innovation, your mission has touched 10 million lives, spreading hope and healing globally. In August last year, my wife Manju, our son Avi, and I visited one of GGH's rural cancer hospitals and a mobile screening unit. As Thomas Fuller said, seeing is believing, but feeling is the truth. Witnessing your impact firsthand was profound, and hosting a fundraising gala for GGH in October 2024, which was a huge success, only deepened my commitment. Wishing Global Grace Health continued success, I'm excited to keep supporting your vital mission.
Hi everyone, this is Subbu Manikunda from Houston, Texas. So I got opportunity to work with Dr. Chinababo Garu, Dr. Pramila Garu missions towards Healthy Society. I'm proud to say I'm the race director of Houston, Texas. We conducted 5 runs already in so far. So 2024 is that's the 5th run. So we have around 500 participants. Every year our numbers are growing. Almost we are doubling the numbers. So when the people say we started running, when they pull the people to run for the run, so then started with 5K and 10K, and then after a few months they ping me, they call me. Some people they call me, hey Subbu, your grace run motivated me to be healthy, and started running. So I completed half marathon and full marathon this year. So that's give you more happiness when you're working with the grace run. And what are the funds we raise towards the run? It's going for the good cause, for the free screening. So that's give you another happiness towards Chinababo Garu's mission. I'm very happy part of Grace Foundation. Thank you. Thanks everyone. Stay happy, stay healthy.
Suresh, you can take it back.
Okay. Thank you very much for the reflections, Das Chebathina and other partners. May I request Dr. Joseph Patori Garu to introduce our keynote speaker.
Thank you, Andy. It is my privilege to introduce Dr. Alok Agrawal. He actually graduated from Gandhi Medical College, Hyderabad, Telangana. He serves as clinical professor of medicine at Wright State University in Dayton, Ohio. He's a well-known nephrologist and a kidney specialist. He's a fellow of American Society of Nephrology and a fellow of National Kidney Foundation. Besides his busy professional work, he has a great passion to serve the humanity. He established a work called Global Pragati, and this work serves in India as well as in the US and other parts of the world as well. This work is supported by his dear wife, Dr. Sangeeta Agrawal, and some of his family members and friends. And he has a special program to bring integrated rural development in many states in India, and he came up with a very successful model to touch the lives of people in the area of education, women empowerment, youth empowerment, preventive health care, infrastructure development, and behavioral modification. And he believes in one word, TEAM, TEAM, which stands for Together, Everyone Achieves More. He actually dreams of a world without poverty. May I now request Dr. Alok Agrawal to bring his keynote address, please.
Thank you very much, Dr. Paturi, for that kind introduction. Greetings to Ambassador Pradhan, Dr. Paturi, to you and all your wonderful team members, all the leaders and all the participants here. So as I pull up my slides, where, okay, this is almost the last slide. If I go other way around, yep, yes. So once again, thank you very much for giving me this opportunity. Today, I'm also joined by Dr. Anil Agrawal. He's a board member of our organization, and he is one of the gentlemen that inspired me to initially start my journey about 24 years back. Also present are some of my team members from Hyderabad. So this is my organization, Global Pragati. Pragati means progress, and that's the website, 501c3. And the organization in India is Pragati Welfare Society, which has FCRA approval also. Next slide. Okay. So, the one thing I believe in is when people ask me how do they go about doing the work, and I think that one word which comes to my mind is compassion. I think once there is compassion, everything falls in place. All our programs, you start realizing the problems of people and then try to solve those problems compassionately. I believe that we are very, very fortunate people. We are blessed with intelligence, education, all kinds of resources. So my heart goes out for the underserved, underprivileged, economically poor, where they don't have those resources. So majority of my work has been in villages. And I think these values have helped me transform my life also. I work beyond race, caste, religion, gender, all kinds of divides, and for last 11 years, one of the salary from our household is used to support the underprivileged poor. Dr. Paturi asked me to talk about initially when we discussed, our healthcare efforts in the organization. And Dr. Paturi, please stop me at about 20-25 minutes. The presentation is very long. Just give me a reminder so I can then increase my speed, Uh, uh, so most of the effort is in preventive healthcare and some of it is in the curative healthcare side. Why is prevention better than cure? I feel like, with the large population and poverty, particularly in the rural areas, some amount of illiteracy there and lack of access to quality healthcare in the rural areas, and with the limited resources, I think prevention is the way to go. And moreover, the curative side, we don't have perfect treatments; they're very expensive. So I think prevention is the way to go forward. And so I've focused a lot on preventive healthcare. We've done work in several states of India. It's not that we are actively working in all these states, but we've touched upon these states and some other states also, during this journey. A lot of collaborations. I was the president of the Gandhi Medical College Global Alumni Association for 4 years, and we did a lot of humanitarian work in our medical college. I'm in actually National Institute of Rural Development in India, National Institute of Nutrition, a lot of other organizations that I have worked with, and these are just a few actually. So in the section 1, I have 3 sections. In the section 1, we'll discuss about comprehensive efforts in Burgula, Telangana, to create a model there. And Burgula is it was a panchayat with about 10 villages, 3 village and 7 tandas, with a population of about 6,000, where we did the comprehensive work. Section 2 will be beyond Burgula, and section 3 will be our global efforts. So, determinants of health, very quickly, I'm just going to go through this very fast. Education, economy, awareness, availability, accessibility, affordability, environment. These are the various determinants of health. And so, to address these determinants in this Burgula model, with 6,000 population, 3 villages and 7 tribal areas, we focused on holistic development, education improvement, healthcare, women empowerment, youth employment, infrastructure improvement, community participation, engagement, or that behavior modification, and each one of this can be a talk in itself. But today we are going to focus on the healthcare aspect of what we have done because of all of your interest in the area of healthcare. And before I move on to that, my greetings to all the women here in the group on the International Women's Day. So all of you do a wonderful job. Thank you very much for that. So, the structure of the healthcare center, there is sub-center and then the primary health center that goes to community health center, district hospital, and then the government hospitals in the city. ASHA workers, ANMs, Anganwadi workers are the foot soldiers on the ground, and they're very important workers. So we came up with, I don't know if you're able to see this slide, the SMILES program on the right side, or is it hidden by the list of the participants here? So we came up with this very simple model in 2017, October to 2017, where SMILES, S stands for sanitation related issues, using toilets, hand washing, simple things, keeping your surroundings clean. M is for maternal and child care. I is for immunization. L is for lifestyle modification that you all have been discussing, and then education means education of the masses. How do we educate? How do we increase awareness in the masses? And screening for blood pressure, diabetes, anemia, tuberculosis, cancers that you also have been involved in. So we actually have taken this to at least easily more than 100,000 people. Directly we have communicated to them directly. Our team has, and indirectly we have communicated it to several other lakhs of people. One of my most challenging project was construction of toilets. And we constructed 650 individual toilets. And 10 of these villages were then labeled open defecation free villages. This is one of the best accomplishment, a lot of hard work there, convincing the villagers, getting all the supplies together to resources, getting the contractor and getting things done in a timely way. We got 12,000 rupees per toilet from government. We put in about 5,000 from our pocket per toilet to improve the quality, increase the size. It also has a bathing area there, and so dignity for women. Again, talking about women empowerment, big thing, and I think I just feel so happy to have this project. And this started I started motivating villagers about 2014 or so, and we started construction late 2015. Went on for 2 years with a lot of challenges. These are the charts we created to educate the villagers about why to keep the toilet clean and what is the importance, and why to use it, sort of. We have put up 3 sustainable reverse osmosis water plants, and so that villagers could have clean drinking water. This one at the bottom is from Punjab, 2 are in Burgula. And then again, working with another organization, Community Pure Water, have been able to do it in several other villages. Again, we were not directly involved in that, but a lot of discussions with the other organization. This is how the village looked, stagnant water and water flowing all over the village. This must be about 2016 or so. And then look at this, one of the street in July 2019 got much better with all the drainages closed, open drainages, and then the same street in 2022 after the construction of this road. Again, we got government to provide funds for construction of the road. But look at all the trees, planting so many trees and all that, so this is just one area of the village, and lot of areas are like that in the village. It's a work in progress. Dr. Paturi, you mentioned that we have created an excellent model, but I think it's a model in evolution still. Work has to be done still. And so this was the open drainage on the right side, hidden by some of these participants. You may be able to see that, this list of participants is there. This school had a leaky roof and very bad condition, and the children were sitting outside the classroom, and classrooms used to be smelly, and all the mosquitoes used to be in the classroom. There was an open drain on the other side of the school. We closed the drain. We actually improved the building. And then this building was recognized as Swachh Pathshala Award and got the Swachh Pathshala Award in Telangana state in 2017. Clean and green villages, we motivated the villagers to clean up the village, community led participant. Actually, inspired by Mahatma Gandhi's efforts, I picked up the broom one day, and started to clean, and everyone came along, So a lot of participation from the villagers. Villagers doing the cleanup. We distributed baskets. I actually hired a couple of people to take this trolley around the village, collecting all the dry waste and wet waste. We distributed baskets. You can see it in the bottom panel there, to all the villagers. Plastic, educating them about not using plastic. Hand wash stations in the schools. Amma program is going on very actively. It's about healthy mother so that the child is healthy. And currently we have about 6, 7 physicians taking turns. Every Sunday there is an online program about healthy mother, and they're educating. 4 of them are in US. Actually 5 are in US and 1 is in India. And there is a hybrid model where when these physicians go to Burgula, they go and do a healthcare camp there. So this is the healthcare camp for the women, and the flyer on the right side for the Amma program. Bharat Bachpan program is for children. You can see how we have gone to the field and we're measuring. You can see some of these pictures where scale is hanging from the tree branches of the tree, and we're getting all the measurements of the children, trying to work on child malnutrition. We go around to Anganwadi centers and motivate the Anganwadi teacher, and also at the same time we are like trying our best to decrease the malnutrition in the children. Likewise, anemia also going to primary school, high school, and educating the villagers about prevention of malnutrition and anemia. This is about menstrual hygiene program. We have actually distributed more than 1.2 million pads in several thousand villages actually, and increased awareness. This program actually stopped around the COVID time, and we haven't been able to resume it as actively. We're still educating the villagers, but we haven't distributing the pads anymore now. So 1 lakh women empowerment program, we had this plan, and this slide is actually from 2019, where we had done about 50,000 women empowerment, neighboring villages, educating them about everything, healthcare, Smiles program, menstrual hygiene program, Amma program, and importance of education and all that. So, again, this was from 2019 and the program has continued. This is an old slide actually. SNEA program is the menstrual hygiene program. You'll see the impact here. Feedback rating 9.63 out of 10 for the program, and 99% of the girls felt that they had learned something new. Immunization, very important. I think one of the picture here is mine on the right-hand top. Distribution of the cloth bags to avoid plastic, constantly educating villagers about importance of not using plastic. They would clog up the drains and other hazards also. Educating the women in the village, and these are all the ASHA workers, mainly on the right side, ASHA workers, ANMs, Anganwadi workers, very important, all the village healthcare workers, and on the left side are our education programs for the village women. Sustained education of the healthcare workers and the villagers. Same thing. Screening of vision, hearing, dental, cancer screening, anemia, malnutrition is an ongoing thing. Very regularly we do that. But again, what I am talking about right now is limited to a population of 6,000, these programs, because we focused on creating a model in a smaller area. I mean, I don't have a team as big as yours. You all have done a wonderful job of having a nice big team. Our programs are very cost effective, though. This is a cancer screening program, and again here cervical cancer screening, breast cancer, and oral cancer screening camp. This is done in Burgula, but there is a van which goes around the villages in around right now Rangareddy and some other districts around Hyderabad. Alcohol sale was banned in 4 villages, but then again resumed during the COVID. So this was pre-COVID. CPR programs. At the same time, we talked to them about the lifestyle modification also. Monthly medical camps impacting several thousand people, regular camps. This is how the health center looked, the primary health center and the sub-center building. One of the photographs. I never took these photographs with the intention of showing a comparison later, but then I dug up these pictures, and compiled them together. So this is how the sub-center looked after renovation, and this is the Smiles program painted on the gates. This is the health center, the green color building, and constantly working with the ASHA workers, improving their knowledge, in different areas of preventive healthcare. Footwear. Footwear was given to the children. The importance is that they don't have the hookworm infestation after that, to prevent the hookworm infestation, and which is a big thing. And then subsequently they develop anemia and other problems, malabsorption, and children performing skits in the village, with the Smiles program that I discussed earlier. So improving the healthcare significantly in the preventive and curative. These are observing different days, AIDS day, tuberculosis, anemia, in the village. Yoga program. Again, it actually is not continuing right now. I think we should restart it. This is our beautiful center on 3 acres land, where from this center we are doing all our activities, not just the preventive healthcare, but education related. Digital literacy is going on, and that women empowerment, youth employment program, stitching training center, digital literacy, and a lot of other programs. And this is where I stay in the guest house there when I go there. Before that, I used to go and stay in the village in a modest single room, place. So this was in 2019. Actually, we constructed this center. Section 2, work outside of Burgula in Telangana. This is a health center we constructed in Kottagudam area with another organization that is working very actively on the ground. Again, my contribution there is very little, honestly. And this other organization I do with the 4 physicians doing amazing work. But, I could support them financially and then connecting them with some physicians in US, always trying my best to guide them to the best of my abilities, but they do the grassroots level work. During COVID, we had a lot of programs, and we actually, one of the best program was we started making masks, actually cloth masks, and we produced about 1 lakh masks, and we distributed it in more than 500 villages across 6 states of India. This is a time when it was very, very difficult it was lockdown period, very difficult to get permissions, very difficult to get cloth, thread, and we had trained almost 400 village women in stitching. And so we gave them some work, and we provided employment to about 200 village women between the phase 1 and phase 2 of COVID. The cycle 2 was, wave 2 was Delta wave, which was very dangerous. So it actually, we stopped it around that time, also because masks were available in the villages and city subsequently, but initially when they were not available, it was beautiful, very nice project, one of my favorite projects, in difficult conditions. And apart from that, oxygen concentrators and all that, I'll skip all that. We provided almost help for 1 lakh vaccines actually around COVID. And So again, hats off to all the people working at the grassroots level, trying to implement all these programs, isolation centers, all those things. Uh, this is how the masks were produced, webinars. Masks distributed in UP, work in Adilabad. I mean, this is non-COVID work. Again, preventive healthcare work in Adilabad area. I already mentioned about Kottagudam. This is in Nalgonda, Healthy Baby program. Jagtial. This is Faridkot in Punjab, some more on the curative side. Likewise, we've done it in last 6 months. We have provided equipment to Gandhi Medical College in Telangana, Hyderabad, also in Kurnool. This is in Kurnool. I was the president of the Gandhi Medical College Alumni Association, and all the accomplishments, particularly, I told the association that I'm not interested in arranging any cruises or, but if there's any philanthropic work, we can do that. And a lot of programs in Gandhi, I've actually shared my presentation with Dr. Paturi. He can pass on to all of you, there's a PDF file also. Basically, trying to create different models of care. So this is the van actually, which goes around doing the cancer screening and other screenings. Section 3, global efforts. This is where, I heard all of you today about lifestyle modification. I've been interested in this topic for about 15 years now, and motivating people to follow a healthy lifestyle, because unhealthy lifestyle leads to all these high blood pressure, diabetes, high cholesterol and heart disease, kidney disease, strokes, a lot of other problems, and then on the right side, you'll see the relation with the kidney disease.
Dr. Agarwal, just a quick note. We have just 2 minutes to conclude.
We'll finish quickly, yeah. So these are my programs of walking programs that I've provided. And a lot of visitors have come from across the globe to study our model in Burgula. And RP physicians have come to Burgula. And, hearing about the 6% below poverty line, one thought which I had is probably the RP physicians, American Association of Physicians of Indian Origin in US can probably look into that. I'm going to let them know. Why is prevention better than cure? I think we'll skip this. Basically, the point I'm making is decrease pill burden. It is cost effective. Once you fall sick, why to go through hospitalizations and why to take all those pills? Better to prevent. So last mile delivery is crucial. Again, one of my favorite slides here where, the joy on this kid's face. I go there, I tell them about different professions. I take all these, I play games with the children, stethoscope and all that. So that is where I think that is the one. Yeah. So thank you very much for this opportunity once again. All of you are doing wonderful job. I'm so happy to hear all your accomplishments. I wish all the very best to all of you. I think, like I said, Dr. Paturi said, I believe word team. Together, everyone achieves more. And all the best to all of you. Thank you very much.
Thank you very much, Dr. Alok Agarwal. It's great to know about Pragati, what they are doing in Burgala and other places in Telangana and other, states. Not only just providing healthcare, but you're educating youth empowerment and community participation. It's really appreciate you. With that note, I will hand over to Dr. Pachuri Garu for before that, if you have any questions, we have a couple of minutes, we are running late, with just few minutes. If you have any questions, you can ask. or you can type it in the chat. I can relay it.
Yeah, probably I can ask one question, Dr. Alok Agarwal. I know you have mentioned about the direct interaction between the hypertension and the kidney diseases. So if you can quickly educate on what are the preventive measures that we can take to save.
If you, who is this? Is this Mr.
It is
Verma who asked the question?
Verma Jampan.
Yeah, very nice. I actually, this is hidden on this. One of the slides which I have is that obesity on the right side was a slide on kidney disease. It's probably third or fifth last slide. Basically, there are direct or indirect ways. I follow the rule of 75%. Yes, this is the one. So 75% of the diabetes is preventable. Actually, the obesity rate is almost like 75% in US. So rule of 75 is like obesity is about 70 to 75%, and diabetes about 75% is preventable. High blood pressure about 75% is preventable. 75% of the kidney disease in US is because of diabetes or hypertension. So if we are able to cut down on the obesity rates through lifestyle modification, we are going to be able to cut down a significant number of people with diabetes and high blood pressure. And that will lead to less of kidney disease, as you can see in this slide here on the right side. That is one of the indirect ways. The direct ways, studies are showing that even obesity affects the kidney disease directly, and without going through the diabetes and hypertension. Add to that smoking and other things, so that increases the risk. So actually, my lifestyle modification journey started with the prevention of kidney disease. As a kidney specialist, I kept thinking, how do I decrease the number of people going on dialysis? And that was the way I said, if people are healthier, exercising more, avoiding sedentary lifestyle, eating healthier diets, there is going to be less diabetes, high blood pressure. The number of pills they take for treating diabetes, high blood pressure will decrease. The kidney disease will decrease. So that was about 15, 18 years back. I started telling all my patients, and got motivated. I started doing, many of you are in Cincinnati, I think. I started with Cincinnati half marathon, and I've continued that. I do 2 half marathons a year. And like Mr. Subbu, I think from Texas, Houston was mentioning, a lot of people have done half marathons and participated in 5Ks and 10Ks, over years. I try my best to motivate people. So I hope that answers your question.
Thank you, Dr.
Thank you, Dr. Agarwal. There's one question from Christy. The question is, on what basis you adopt a village and work with them to bring change?
Yes. So answer is, I started my work with Dr. Anil Agarwal. I mentioned in Haryana. I don't have any of my own village. And I worked there for about 6-7 years, starting in 2001. Going from Hyderabad, I grew up in Hyderabad. Going from Hyderabad to Haryana was challenging, with my young career and children who used to accompany me to Hyderabad. I would leave them back in Hyderabad. 2007 December, 2008 January is when I met my social studies teacher in Burgula. And always you need a champion in these places, So we started with some small work in education field, and it grew. And I went around the village. I saw all these problems, no clean drinking water, toilets not being there, and unhygienic conditions and education. So I think I started doing this integrated development. And like I said, I didn't have a big team. I said, let me do what I can do, and we've tried our best. So I think that's the answer to that. Always you need a champion there on the ground, and start your work. Education is a very good area to get into the village. Very neutral area to get into the village. And preventive healthcare is another one, I feel.
Thank you, Dr. Agarwal. Thank you very much. With this, keeping an eye on time, I hand it over to our President, Dr. Joseph Poturi Garu, for a vote of thanks.
Thank you, Andy. We scheduled this Zoom celebration for 85 minutes. So we are wrapping it up in a minute or two. And thank you so much for everyone joining, not only from across the US and also from India and even from other parts of the world as well. We are so grateful that you could take time from your schedules and even late evening in India and some places, but you could join at this time. We are grateful to all our partners again, and the promoters and donors and doctors and medical professionals and volunteers who are investing their time, talent, and even money as well to support the work of cancer awareness, cancer screening, and coming up with the line of treatment where required. As we look forward to the future, we would like to continue to work together and accomplish much more in the years to come, and using even technology like AI. Thank you so much again for joining again.
Thank you, Dr. Poturi. I request Verma to play our GGH Grace Cancer Run theme song while we conclude.
Run, run. Run, run. Run, 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 run. Run for grace to every mile. Scream for life with every smile. Together we stand, strong and true. Run for grace, we'll see it through. Run, 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 run. Run for grace to every mile. In the morning light, we lace up our shoes, running with hope in a world we choose. For every heartbeat, for every life, we run for grace and scream for life. Run, 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 run.
Great. Thank you everyone for participating on behalf of GGH board and also GCF. I once again thank each and every participant taking time, and hope to continue this run to impact on our communities and societies with a great health and other support. Thank you again. Thank you all.
Thank you, Suresh. Thank you, everyone.
Thank you, everyone. Bye-bye.